So hello everybody, my name is Justin Park. I'm a, I'm a medical physicist and the director of adaptive radiotherapy at UT Southwestern Medical Center. And today I'm going to present the Ethos Adaptive Radiotherapy System, which is the only Cone-beam CT-based adaptive radiotherapy machines that is commercially available as of now. To go in, I would like to just go through the goal of adaptive radiotherapy. The goal of adaptive radiotherapy is an extension from the traditional radiotherapy, which is to deliver the maximal therapeutic dose to the tumor area while sparing the minimum dose to the surrounding healthy tissue. But in adaptive radiotherapy paradigm, we would like to extend at inter and intra-fractional basis. And what we would like to see is in our clinical outcome is to increase the survival rate of the patient, increase the local control, decrease the toxicity, and ultimately improving the overall quality of life. And also in radiotherapy perspective, we would like to discover unseen boundaries of radiotherapy and expand our boundaries and therapeutic ranges of the other disease sites. So in order to do this, we would like to, there are several requirements for the ideal online adaptive process. First, we would like to get the highest quality volumetric images achievable. And in order to, and for online adaptive process, we would like to, it is important to track and determine the changes in the internal and external position of the anatomy. Therefore, we would like to have the best, highest quality soft tissue imaging possible. Second is electron density informations. So most of the other modality imagings rather than CT does not provide electron density informations. However, electron density information is important, crucial for dose calculation purposes. So therefore, finding a matrix to propagate electron density to MR or other modality imagings rather than CT is crucially important. And third, on the physician perspective, the automatic contouring needs to be performed. Fast and automatic contouring tool needs to be available. And also, in case that the automatic contouring is not perfect, capability of a manual corrections with easy graphical uses interface is crucial. Fourth is the plan after the contouring is done with electron density propagation. Those needs to be calculated and the plan needs to be re-optimized. And in current settings, in the current traditional TPS, these processes are extremely slow. Therefore, in online adaptive process, we would like to have this calculation as well as re-optimization done as fast as we can so that we could minimize the intra-fractional motions that could potentially happen during the course of adaptive radiotherapy. And finally, after all the re-optimizations and dose calculations are done, it is impossible to patients to pull out of the machines and do a physical measurements to do a QA quality assurance. Therefore, to replace that, we would like to have the most reliable independent plan and dose verifications tool in order to ensure and replace the physical patient-specific measurements. So UT Southwestern currently is in the procedure of major expansions. We are building a brand new building called the Adaptive Radiation Oncology Center, AROC. And once this building is built up, our plan is to put 7 adaptive machines, which is 2 Elekta Unity, that is MRI-based LINAC, 2 Varian Ethos, which we are going to discuss very shortly, 2 Varian Halcyon, which is the father of Ethos, 1 Philips Ambition MRI simulator. And once these 5 machines are installed at this machine by end of latest September 2021, according to my knowledge, it will be the single building that possesses the most most adaptive radiotherapy machines in nation and if not at the globe. So let's go into Varian Ethos. So Varian Ethos is the only ring-type cone-beam CT LINAC integrated system that is currently available commercially. Other ART systems are MRI-based LINACs. It delivers 6 MV FFF beams, which is flattening, filter-free. The bore size is 100 cm. One of the unique features of this ring-type cone-beam CT and LINAC integrated system is enables the faster cone-beam CT scans. So unlike traditional LINAC cone-beam CT systems, where the CBCT maximum CBCT scan can be done in 1 minute, it enables 16 seconds, which is 4 rotations per minute. So the biggest advantage of the CBCT able to acquire within 16 seconds is that the patient can be asked for breath hold during the course of the cone-beam CT scans, and that enables a huge major improvement in terms of image quality compared to the traditional LINAC-based cone-beam CT. And another feature that comes up with the Varian Ethos is advanced cone-beam CT reconstruction, which is called the ICVCT, which potentially improve the traditional way of reconstructions and display better visualizations on cone-beam CT. And with the use of this huge improvement of this image quality, online plan adaptation is achievable. And from all the other compared to other MRI-based LINAC integrated systems, it is the only machine that can deliver volumetric arc therapy that is currently available. So Ethos adaptive workflow comprises in 3 steps, which is initial planning, which is basically simulations planning with the use of a simulation imaging. The 2, which is the juice of this adaptive, which is on-couch adaptive workflow. And 3rd part, which is treatment monitoring, which is post-treatment monitoring. So, so if you look at all these procedures, the only procedures that coincides with the traditional LINAC-based traditional LINAC-based approaches, just the setup and cone-beam CT treatment and delivery. Rest of the other features that is provided by Ethos is very, very unique to itself, that is optimized for the online adaptive process. So, so first step, and going into each of the steps a little bit deeper, on generation of initial planning, Ethos is designed to optimize the way in which that clinicians generate prescription with the use of templates, which allows clinicians to create many goals within seconds, such as target dose and OAR constraints. The template is then fine-tuned by interactive 3D prescriptions and is performed by real-time dose preview that allows for evaluation of trade-offs in organ sparing and target dose coverage. After fine-tuning, AI, artificial intelligence-driven IMRT and VMAT plans are auto-generated using graphic users card for those calculations and optimizations. And finally, the plans are compared against physician's intent using matrix to streamline the comparison between the achievable plan and the actual original physician's intent. Then, after followed by the initial planning stages, the on-couch adaptation happens during the course of actual treatment. And Ethos designed to provide a Radon team with the ability to deliver adaptive therapy within a typical 15 minutes of the time slot. And this comes from the fact that the Ethos can generate much higher quality of cone-beam CT images compared to a conventional LINAC cone-beam CT as shown in this slide. And the key feature of enabling this high-quality cone-beam CT is from the accelerated cone-beam CT acquisition, where it can be as fast as 17 seconds with the length of 38.5 cm in superior and inferior extent. And as an optional, eTref cone beam CBCT, which is also called the iCBCT imaging, helps clinicians to visualize the patient's anatomy to facilitate delineating the organs. Followed by the cone beam CT reconstructions, AI segmentation technology automatically contours healthy tissues in between 15 to 30 seconds. And once all target contours have been accepted, plans are auto-generated for the review. And finally, once all the segmentations and the imagings are performed, there comes to the adaptive therapy replanning, where it is a streamlined standard workflows that enables a fast mastery by the physician clinical teams. The Reoptimizers is ergonomically designed to be intuitive, friendly, and comfortable for staff patients. And the system has the flexibility to choose between the adaptive and non-adaptive treatments in case the adaptive replan is not satisfactory. And in overall, all these on-couch adaptation, the system is designed with a high-end computational workflow that can be completed in a typical 15 minutes time slot from setup through delivery. So after adaptive radiotherapy of each fractions has happened, unlike a traditional LINAC that only scores daily delivered dose at its most, daily treatment data is automatically saved back to the patient's chart for treatment course monitoring. And in that process, the automated dose accumulation is applied to forecast and monitor treatment progress and assist physicians' offline adaptation decision-making process. So, use of this in conclusion, with the use of this ethos system, our goal is to separate between the Unity and the ethos of patients and maximize the benefit for the patients with each respective machines. And in two ethos machines, our goal is to treat about 10,000 fractions per year, which is a mixture of adaptive and traditional treatment. And currently, we are anticipating that to treat head and neck, GYN, GI, and GU cases. And to do that, currently the physicians and physics teams are designing the head and neck SAC, intact cervix, intact endometrium, anal, preliminary recurrent rectal, and prostate cases for the ART that is going to be treated with ethos. And hence, therefore, it'll be exciting next in the following years. There will be exciting moments where if you come to UT Southwestern, you'll have a very unique opportunity to participate in trial and produce experience, a very unique experience that cannot be experienced from the other clinics. This is all for my today talk, and thank you for listening to my talk. Thank you.